Hello, everyone. My name is Iesha Glover, and I am a trauma-informed certified yoga instructor with Balance and Birch Wellness Online Center. This means that I assist trauma survivors as well as neurodivergent individuals with managing their symptoms more effectively on their day-to-day lives. And we do this by working one-on-one with our clients and formulating a customized treatment plan that is based on their personal and wellness goals, as well as their physical goals. Now, some of these wellness modalities may include yoga, breath work, as well as different types of guided meditations. And I'm so excited for our episode for today. I am here with Dr. Ellesar, and we are going to speak about the importance of practicing self care from my perspective as a professional who works closely with neurodiverse individuals and as an autism mom, as well as the perspective from Ollie, who is also neurodivergent themselves. So, without further ado, let's get started. Ollie, welcome to the podcast.
Thank
Um,
you.
you're very welcome. I do want to say that I am honored to, and thank you very much for letting us, have the interview today or being a participant of the interview because I have been honored to work so closely with you this past year, and you have provided me so much different insight within the community, and I've learned a lot from you. So I just wanted to say thank you, and I'm really happy to go through our interview today. So, would you please introduce yourself and let us, as well as the audience, know what you have to offer within the Balanced and Birch community?
Yeah. I'm Dr. Ollie Ellesar. I'm a psychologist. Um, and I primarily work with autistic individuals and people with ADHD. Oftentimes those two overlap, like I'd say more often than not. And then with that tends to come chronic illness and trauma. So that's other areas that I'm specializing in. So I'd say the bulk of the clients that I work with are some combination of neurodivergent, chronically ill, and have a whole bunch of trauma. Um, so yeah, that's pretty much what I do. I do something called internal family systems therapy, or some people might know it as parts work. It's just like the idea is we're all made up of different parts that developed over time in response to our experiences, and they all have different jobs. And a lot of the times as we go through life, our parts don't communicate super effectively, and it can make us kind of feel disjointed inside. And so I help people connect with their parts and communicate better so things are more balanced and move more smoothly. It tends to be a pretty long process. It's not a therapy that's a quick fix by any means. It definitely takes a lot of time because some parts do not want to be seen. So it can take years for them to feel comfortable making
Mm.
themselves known. So it's very, very rewarding, and it's fun, I think, just to conceptualize people as having parts. It's the therapy that's helped me most personally too.
Mhm. Yeah, and I'm
Yeah.
actually pretty excited to get into that because it does sound very interesting, especially um, tapping into your parts and really understanding where they're coming from, and how that forms you as a person individually. Um,
Mhm.
so just a preempt question for you. How has your connection to neurodivergence shaped your approach when working with neurodivergent individuals?
I would say it's completely changed how I approach therapy. Um, Pre-diagnosis, I relied a lot on. I was diagnosed in November of 2021, so almost 3 years now. Um, and I didn't know I was autistic until like July of that year, so it was very new to me.
Mm.
Um, and I was taught to do therapy a very specific way. And it was very colonialized, ableist type of therapy, really rooted in a lot of like systemic structures in the United States that are put in place to really disable people and keep them down.
Mhm.
So I quickly started to realize, like, oh, well, none of these therapies have worked for me.
Mhm,
All of these autistic people whose stories I'm listening to, like on social media, I know TikTok gets a really bad rap, but I found it so incredibly helpful to listen to people tell their own stories
mhm,
about what's worked for them and what hasn't. I think listening to people's stories is just the one of the best ways to learn.
mhm,
Um, and I started realizing like, oh, well, these therapies aren't working like cognitive behavioral therapy. Like, yes, it's good in some regards for some things,
mhm,
but I think when it was used as the only treatment for autistic folks who had things are experiencing, it just I don't know. It just doesn't really seem to help very much. And a lot of my autistic clients are hyperverbal
mhm,
and tend to hyper analyze and intellectualize. So they're able to skirt by in cognitive behavioral therapy pretty much undetected. And they usually resoundingly get the comment, "Oh, well, you have so much insight. You're so self-aware. What are you doing in therapy?" And it's like, well, I know something doesn't feel right inside, but I can't put words to it because of alexithymia, which is an inability to like connect with and identify feelings.
mhm,
And so, I don't know, as I've learned about autism within myself and in other people, I've very drastically shifted the types of therapy I use. And the reason that parts therapy is one of the big ones I use is because I use it in a way that I don't necessarily know it was intended to be used. But because so many of my clients struggle to directly connect with their feelings, if I can have them personify their internal experiences, so therefore kind of almost externalizing it, they can kind of actually connect with it more easily
mhm,
than if it's inside,
mhm,
right? There's this myth that autistic people don't have empathy.
mhm,
It just isn't true. Um, sure, I mean, we're human, so like there's a range of things we experience. So of course, I'm sure there are some autistic people who don't feel empathy because there's neurotypical people who don't feel empathy. But a lot of times I think what it is there's a missing step of I don't understand what is happening, but as soon as someone explains it to me, oh, then yeah, I can feel empathy.
mhm,
That makes sense.
mhm,
So I feel like parts work is it fills that missing step, um, and helps autistic people understand themselves better. And I also do something that most therapists would say, don't do that. Um, but I take my autistic clients' ability to intellectualize and I use it as a tool to get them to feeling.
mhm,
So if they can't feel their parts, but they know themselves well, I get them to tell me, what do you think is happening? Okay, let's just go with the assumption that this is that what's happening with that part.
mhm,
Let's roll with it.
mhm,
As you have experiences and you notice that part coming up, try to notice if anything changes in your body.
mhm.
Like, do you notice that you get really angry? Your stomach hurts, you start yelling, you feel like your head's gonna explode, you have a meltdown. And then they start to be able to connect with their feelings.
Yeah.
But a lot of therapies like CBT are like simultaneously tell you to hyper intellectualize things, but also totally feel your feelings, and it can get really confusing.
Mhm.
Um, and I think a lot of my autistic clients really, truly, I just see them thrive while using parts work. Um, Yeah, it was just an accident. Like, I
Yeah.
thought parts work was fascinating, it worked for me, and then I used it with my clients, and it works really well.
That's actually very amazing how you kinda it's almost like you're debunking or, shifting the traditional talk therapy. You're actually emphasizing the somatic work, really feeling it in the
Yeah,
body and getting to know yourself a little bit deeper, allowing those feelings to come to the surface, and then being able to understand them a little bit more. So
yeah,
that's amazing.
yeah, I really like it. It also helps, like, it helps me help my clients normalize, like, that it's okay to not feel good about something,
Yeah.
or that, like, if you're doing something that has been shamed or discouraged, like, that part of you that's doing it, it isn't bad, it's not shameful, it's doing it for a reason.
Mhm,
Let's figure out why so that we can show it compassion and love and support.
mhm.
And then things tend to usually dial down in intensity when you start to give your parts compassion.
That's
So,
amazing. That's
yeah.
amazing. All right, so let's get into our self care portion. Dictionary.com defines the term self care as the act of attending to one's physical or mental health, generally without medical or other professional consultation. Now, my personal definition that I like to add, self care means unapologetically filling your cup before offering space for others. This means doing something that you love, and that could be whether a special hobby or some type of physical activity, and incorporating that into your daily routine so that you have the heart space and grace to genuinely care for others. So, my question to you is, what's your personal definition of self care? And do you think it's important to incorporate it into our daily lives in order to sustain our well being? And that's just, you can give from your perspective in general. So, what do you think?
I definitely think it is, and what I talk to a lot of my clients about, and something so my fiance is also, ADHD, so autistic and has ADHD. Something a very big theme in my life personally and professionally is this conversation of, okay, ideally, we incorporate self-care activities daily. Realistically, we live in a capitalistic society that forces us to work in order to be able to just survive. And again, with a lot of my clients, they're chronically ill. So, like, they're always in this bind of like, well, I literally cannot physically afford to work, but I can't financially afford not to. And I need the money to pay for my doctors because even with insurance, doctors are wildly expensive. So, self-care becomes like the discussion around it becomes much more one of like practicality
Mm,
and also a discussion of like less physical activity of self-care activities and more of showing yourself grace and compassion and forgiveness. So for me, for example, if someone were to come into my life and observe me, they would say like, "Wow, you don't do anything to take care of yourself or like fill your cup."
mm,
But I do, it just looks very different. So
mm,
for me, it's going to my individual and couples therapist, like, I see them cumulatively like 3 weeks out of the month. And then staying in contact with my primary care provider as she like sends me out to different referrals and touching base with her. It's making sure I see my psychiatrist regularly to make sure my meds are solid. It's so like that is a big part of self-care for me. Like
mhm,
going to doctors. I
mhm,
even if I don't want to, it's like I have to make sure I'm doing it so that down the line I'll be able to take care of myself better or at least more consistently. And then I think too, as an autistic person, and a lot of my clients echo this with like ADHD, you don't have like the brain capacity to maintain structure and schedules enough
mm, mhm.
to be able to implement daily self-care.
Okay.
Like a lot of times I think we forget we're allowed to.
Mhm,
Like I forget that being by water makes me feel so good
mhm,
and just decompresses me immediately.
mhm.
But so often I like forget that my life isn't just the four walls of my apartment
Yeah.
because I think going out in the outside world can be kind of scary as an
Mm,
autistic person. And also with chronic illness and it being unpredictable. Um, I know I'm kind of like tangenting, but it's because like for me, self-care is such a complicated topic.
mhm,
And it, like, for me, it's not as simple as like take a nice bath with a bath bomb and read a book because my eyes don't work, so I can't read now. Or like I have POTS, so if I take a hot bath, my heart rate's gonna go out of control.
mhm,
So it's like these things that a lot of people recommend for self-care, I can't do. So I really have to get creative. But again, the big thing I do is I just really work hard to show myself grace and forgiveness
mm,
when I'm struggling. It's doesn't always happen, it doesn't always work, but I'd say, like, those are the core tenets of self-care that I emphasize, like, for myself and my clients. Um, and then another thing I try to encourage a lot of my clients to do is to, like, pick one single thing that could possibly make them feel a little bit better
mhm,
and only focus on that one thing and not like only focus on it, but in terms of trying to add it into your life, try not to spread yourself too thin. and see like, okay, for me, it's a skincare routine.
Mhm.
I used to never do them. And now I wash my face and do a skincare routine like 3 times a week,
Mhm.
which to a lot of people, they're like, that's not enough. But for me, that's huge.
Yeah.
That's way more than I was doing before. And actually, I've noticed I feel really good when I do a skincare routine.
Nice.
It makes me feel like I'm taking care of myself. It like I can look at my skin and say like, okay, it's not as broken out. It feels moisturized. So it's also just like remembering that you need to go at your own pace and you need to accommodate yourself. And sometimes that means doing a 1 or 2 minute skincare routine once a week and then
Wow.
slowly trying to build on it. Um,
That's very
yeah,
interesting. That's very interesting because if I was to answer the question from my perspective, I wouldn't think of that. Now it sounds like, and pardon me if I sound a little bit insensitive, but it sounds like it's very simple, right? Going
yeah,
to the doctors to take care of yourself, or just having breakfast in the morning, right? Just having
yeah,
drinking water through, or remembering to drink water throughout
yeah,
the day. That is actually self-care.
yeah.
But if someone was to ask me that specific question, what is your self-care routine? And I'm like, wow, I want to do yoga, 3 times a week, and then I journal, and then I like to meditate before bed. Um, it's not so simple because, like you said, it's a structured routine that I try to keep for myself, in order to maintain that type of self-care. But in actuality, I can kind of just relax a little bit and say, hey, well, I'm going to the doctor's today, and I'm also going to have breakfast, and that's going to be my self care for the day. And that's going to be okay. That's going to be okay. So that's very interesting, that you mentioned that, because a lot of times you don't really think about it. You just do it, right? Especially if it is part of your routine. But as a neurodivergent individual, sometimes it's not so simple. It's not that simple to, to maintain those everyday habits like drinking water. So that's very interesting. Um, how do you prioritize self-care as a therapist, especially while managing a neurodivergent identity?
Only my answer is I don't.
Okay.
Um, a lot of what so this is another comes back to capitalism thing. I
Uh-huh.
don't have the capacity to work.
Yeah.
I don't have a choice.
Yeah.
So, but I'm very, very lucky that I'm working with a population of people that I feel very comfortable with
Hmm.
because like we're in the same community.
Hmm.
A lot like, we share a lot of overlaps in our identities.
Hmm.
So like obviously I maintain professionality with my clients. It's not like we're like besties,
Hmm.
but having sessions with my clients is really easy.
Yeah.
Like, that's not to say I don't end up emotionally exhausted or burnt out. I do. I
Hmm.
hit walls and it's really bad. But my clients are always so understanding because they experience it too. So if I have to like suddenly like I'm hitting a wall and I feel it and I've got to cancel like 4 days of clients, they're like, "Hey, look, I get it.
Uh-huh.
Like, thank you for prioritizing yourself." Or for like, I've even had clients thank me for demonstrating what it looks like to have good boundaries
Mhm.
around needing to take care of yourself. So I think I'm in a uniquely lucky position where my job as a psychologist and therapist, I don't think is nearly as taxing. Because the flow of my sessions, it just feels incredibly natural. Um, again, it is tiring, but I think in terms of prioritizing my like self-care, I just do the best I can.
Yeah.
And
Just
that's it. And just like try to make that good enough.
okay. So, do you believe in the word balance? And if
Yeah,
so,
I constantly use that with my clients.
yeah. So
Yeah.
how do
Well,
you incorporate the balance? Like how do you incorporate the balance without the burnout? Because you have clients who, yeah, they understand that you all have that in common, that you all are uh neurodivergent individuals. So you all have those similarities, but how do you incorporate the balance between the work life and not feeling burnt out?
well, so you don't. So something that I don't think is talked about explicitly enough, autistic people very, very often, one of the reasons they're not working is because they cannot find a job to accommodate them.
Hmm.
And it's not that, like, I don't feel accommodated at Balance and Birch or in my own practice, I don't accommodate myself. I do, but there are only so many accommodations that can be put in place for a therapist. Like, I can't put in 50% effort as a therapist. Like, I need to be fully present at all times.
Hmm.
So there's this inevitability of burnout with
Hmm.
autistic people. It is going to happen. It is absolutely going to happen. And so the conversation I have with my clients around balance, we kind of redefine balance. So balance isn't every part of your life is in balance. It's what is most important right now and what is dire.
Hmm.
And how do we create balance around that? So for a lot of my clients right now, with the economy, it's money and health. So I say, like, all right, those are the two priorities, whether you want them to be or not. Like, you've told me they have to be. So how do I help you make sure that you are, you know, being able to work, pay bills, go to doctors or whatever, while also not burning out to the point where you can't recover?
Hmm.
So sometimes that looks like, can you request accommodations at work? Can you work part-time? Um, if you have a partner or a spouse or a roommate, are they able to take on more of a financial burden to give you a little bit of rest? Are you able to take FMLA or paid leave? Like, w we have to get really creative, and sometimes at the end of the day, the answer is, "No, there's literally nothing I can do," and then the conversation becomes, "All right, we have to accept that this part of your life is going to result in pretty serious burnout,
Hmm.
and we're going to do everything we can to try to prevent it,
Hmm.
but we do not live in a society structured to support disabled people, so a lot of us end up having no choice but to burn ourselves out." So,
Hmm.
like, my 5-year plan is to not be a psychologist anymore
Okay.
because I don't think I can sustain it as much as I love working with the people that I do. They're incredible.
Hmm.
It's just I don't think I can physically and emotionally sustain it because I also have chronic health conditions that are probably going to get worse.
Hmm.
And I don't wanna cancel on my clients. I don't wanna be an inconsistent therapist. Like, they deserve better than that.
Hmm.
So I, in the next 5 years, need to find a different job, maybe using my degree or something else.
Hmm.
Um, and so, like, sometimes that's the plan for burnout.
Hmm.
It's having a light at the end of the tunnel and knowing, all right, I have to suffer through this for a while. And, like, I ask my clients, like, is this what you're feeling currently in terms of burnout? Is this the kind of burnout where if you do not make a change in the next month, it's going to end in serious, potentially irreversible negative consequences to your well-being? Or is this, okay, I'm cluing into that this is not the lifestyle that works for me,
Hmm.
and we need to start moving in the direction of planning for a different life, and that becomes like a long-term plan. And okay, can we project out how many years that might be? And sometimes they don't have answers, and it's just day to day. um, but yeah, it's really being neurodivergent and, like, knowing I am and working with neurodivergent clients has completely restructured how I see everything.
Wow. Wow. Yeah. And then having that self-awareness and then offering yourself grace, like you mentioned earlier in the conversation, as a part of being, a part of being or having a self-care routine. And actually knowing, like, I don't know if I can do this in 5 years. You know what I mean? I don't know if I'll be able to sustain. So actually knowing yourself enough to make that decision is very powerful, because you'll have people that will kind of just go through it and not really know a way out or find a way out, which is
Yeah.
which is very unfortunate. Um, but I think that in itself, offering yourself grace and having the self-awareness to know exactly how much you can handle, and having the ability to see the light at the end of the tunnel is self-care enough. So
Yeah.
that's beautiful. Can you provide a general rundown of how an onboarding would look with a potential client?
Like, if I got a referral for a new client, like, what it would look like?
Yeah.
Yeah, so a lot of times I will just get referrals from Psychology Today where someone will email or call me and say, okay, I saw your profile. I think we might be a good fit. So usually I immediately respond and explain to them that I'm licensed in North Carolina, and so I can transfer them to my practice and take their insurance if they're like Aetna, Blue Cross, or Cigna. But if they're in Maryland or DC, because Dr. Brown is supervising me until my PSI goes through, I cannot take their insurance because Balance and Birch doesn't currently take insurance. So I tell them my usual rate, and then I talk about like maybe we can talk sliding scale depending on like income and like expenses. And then usually by then they'll be able to tell me like, oh wait, yeah, that's actually not going to work. I need to use my insurance or something. And then I'll say like, okay, if this works, let's schedule a consultation. We talk for like 15 minutes. They tell me what it is that they're looking for in therapy and a therapist. I tell them about IFS, a little bit about my approach to therapy, some of like not just like therapeutically, but also like I try to work through like a decolonizing lens. I try to talk to my clients a lot about how there are like systemic structures like white supremacy and patriarchy, capitalism, ableism that affect all of us. And I try to invite my clients to talk about that if they'd like to, but also let them know that we don't have to if that makes them uncomfortable.
Mm.
And then if they feel like it's a good fit, then we book an intake appointment, which is just where I do like a history gathering. And usually at that appointment, I ask them how often they'd like to be seen, and then we put something regular on the schedule.
Awesome. And so, how can you tell people how they can find you and reach out to you if they are interested in services?
Yeah, so on Psychology Today, if you search Oleander Ellesar, um, Ellesar is Ellessar. Oleander's a flower. So if you attempt to spell it, it'll show up on Google. If you put that in, I'll pop up on Psychology Today. And if you are in North Carolina and want to use insurance, you should go through somewhere on the Psychology Today profile. It has like a web address for Headway.
Mhm.
It's the what I use for billing and insurance. You should use that. Just like copy and paste it into a browser and like schedule a consult with me there. And then also Balance and Birch's, I think, web address is also on Psychology Today. So if you're either wanting to work with Balance and Birch to get like all the services, you don't really need to use insurance, or you're in Maryland or DC, you can go to that web address. And Balance and Birch has the ability, like they've got like a tab where you can schedule consultations as well. Um, yeah.
All right. Thank you so much. And before we go, I have a few rapid fire questions, fun rapid fire questions, I think, that will close out our session. They're very short, so you don't have to provide any long answers. Maybe one or two words will be fine. Okay. And don't think too hard on it. Okay. You just give the answer that comes to your mind. You ready?
Hmm.
Your go to way to relax after a long day.
Watching Supernatural with my fiance.
Your favorite therapy tool or technique.
Um, IFS, but like with guided imagery.
Okay. If you weren't a therapist, what would you be?
Uh, Probably a writer or an artist or musician.
Okay. Coffee or tea?
That's a hard question. I'm gonna go with tea because it's more versatile.
Okay. A song that always boosts your mood.
Any song by Hosier.
Nice. Your favorite book.
White Oleander.
One word that described therapy in 2024.
Complicated.
One word to describe your day off.
Lazy.
The best piece of advice you've ever received.
Um, this is a good one. It stayed with me. My friend in high school gave me this one. Like try not to beat yourself up with regret because at one point in life, you know, the decision you made was something that you wanted. I know
Mm.
that doesn't extend to everything because there are things we do that we're going to regret, but I like to try to remember that like there will be different versions of me throughout life and I can show them all compassion.
I love that, Ollie. That's the perfect way to end our episode today. I'm going to take that with me. I really appreciate you, Ollie. I appreciate your
Yeah,
time. I appreciate your perspective. Did you have anything else to add before we close out?
I don't think so.
All
Thank you. I
right.
really appreciate it.
Of course, Ollie, of course. We're a team.
Yeah,
You enjoy the rest of your night, Ollie, and I will talk to you soon.
sounds good. You too. Bye.
All right. Bye bye.